Milford MD. Good morning. This morning's project is Lipo 360, which is liposuction kind of all the way around. So it's the abdomen above the belly button, the upper abdomen, the abdomen below the belly button, so the whole abdomen, plus the waists, those are here and here, and then on the flip side, the hips. Every person is different, so the sculpting is different every time. I tend to make some little geographic marks, some topographical ideas of what we're going to be doing. We're going to bounce the fat cells off and suck them out very nicely. They're going to be alive, but sort of dispersed. And we're going to reuse a bunch of that fat, put it in our patient's buttocks. So we're going to be doing a BBL, Brazilian butt lift, that is to say AFT, so autologous fat transfer, which means your own fat put somewhere, in this case the buttocks, for the purpose of getting some upper contour enhancement. We're also going to be liposculpting in, so have the waists doing this and the hips above the buttocks curving nicely in, and then the buttocks curvy out. We put the fat kind of in the upper outer half, maybe a little bit centrally to give a nice circular projection. You don't put it down at the bottom, towards the inside of the buttocks where you sit. So I don't think you really have to worry about sitting on the transferred fat afterwards, because if you take notice, you'll see you're not really sitting on that area. That's the project for today. This is our Vaser wand. We have different lengths of tools and different sizes of tools. That's actually a smaller one. Might be more suitable for a neck or some small area. You can see that's a little thicker and a little longer. It's nice for the abdomen. Actually, thicker tools are safer than thinner ones because it's very easy to know where they've gone, versus thinner ones, which might have a tendency to drift, and one has to be extremely careful all the time and to know where they are and what one is doing. I don't know if you can hear this vasering sound, and if you look, this is kind of sticking a little bit when I put it in. It's being blocked. If I do this a little bit, now you can see it's getting very, very easy to do. And in fact, I can just, my hand is not around it, it's just gliding in. In some cases it's sticking because it needs some more attention. But once it goes smoothly, then it doesn't take any effort. Anyway, we're going to run around the whole abdomen, later the waist, later the hips. Our patient should have an amazing result. Maybe I'll bring you back later, show you some fat transfer or something else very exciting. Thank you for watching. Milford MD. Richard Buckley, Milford MD. Remember this morning's project with Lipo 360 with Vaser to bounce fat cells off, liposuction, and then Renuvion skin tightening, also saving fat along the way so that we could put the fat into our patient's very own buttocks, so her very own fat cells into her very own buttocks for the purpose of Brazilian butt lift. I have not sculpted this part here, the hips. I started on the waist a little bit. The hips are going to be sculpted in, so they'll be nice and curvy, and then the buttocks will have some nice backward projection and some uplifting. Fat goes in this part of the butt. It doesn't really want to go down here on the bottom so much. Maybe a little bit in the center. This is my fat. I have lots of these. I'm at a different angle than usual so that you can see what I'm doing. I have a little cannula. Often I use a smaller one than this, but this is fine for what we're doing here today. And if you can zoom in tight on that, you can see there's fat here, and I'm laying down beads of living fat cells. Those fat cells are going to get themselves established, and they're going to be very happy in their new home. Our patient's awake, by the way, although she slept. But you said, what, like a spa?
Yes, it's like a spa.
It's like a spa, and the music you said was good? Great?
Yes, great.
Yeah. All right, so that's it. You can come to Milford MD for spa-like treatments, including autologous fat transfer, fat grafting, Renuvion, Vaser, Lipo 360, laser lipo, smart lipo, so many different kinds of body sculpting options, plus surgical things. Come see us. We'll help you make a plan, see what's appropriate for you. Thank you for watching. Milford, MD. Richard Buckley, Milford, MD. You remember we're doing Lipo 360 with fat transfer to the buttocks. I wanted to show you what the difference starts looking like as it begins to go up with the fat. We're just slightly over 100 cc's of volume in this buttocks right now. Nothing in this one. I think you can get an idea that the contour is starting to come up. And in a while, I'm also going to do some liposuctioning of this area and curve this in, and you'll even be able to see it more. So we took this fat from our patient's tummy, from her abdomen, and we will get a bunch more on the waist and hips, and plus I have a bunch more ready to go in, and I will continue the project of elevating these buttocks. And yeah, our patient's laughing, she's awake. And so what do you think? You excited about this?
Yes, I don't think you say buttocks.
Buttocks, I think that's what it is, like mice, meese is plural, I think, yeah.
Yeah, it's amazing. I'm excited.
This is going to be amazing. All right, thank you for watching another episode of Milford, MD.